Today we're going to be diving into one of the more complicated and least sexy topics of all time. We're going to be talking about the world of chronic pain and chronic disability. As a heads up, this is a very complicated topic and we might be getting into the weeds just a little bit, so if you do have questions, go ahead and ask. I will also very likely be splitting this one video, which would be very long in duration, into two. The first part of which will describe what causes chronic pain, and the second part of which will be just one method of addressing it. I promise to do my best to find footage that best represents what we'll be talking about, but I think it's gonna be a little difficult. Regardless, let's get into it. Within Canada and the United States, about 1 in 5 people are expected to be living with chronic pain. That's a lot of people. We're talking about 60 million. And let's get two things clear right off the bat about that population. First off, chronic pain sucks. It has the potential to redirect entire lives and is very, very complicated to be managed. And number two, people with chronic pain are not exaggerating or lying about the levels of discomfort and disability that they deal with on a daily basis. To someone who does not live with chronic pain, a simple nudge in the shoulder may feel just like that, a simple nudge. But to people suffering from a true chronic pain condition, a nudge in the shoulder may feel a hell of a lot more like a haymaker. This is because at the physiological and cellular level of the chronic pain patient, that nudge may elicit a response very, very similar to what a haymaker would in a non-chronic pain patient. It's important to understand that our perceptions of pain are based off whatever chemical reactions our body are currently undergoing. If our nociceptive or pain nerves are being consistently triggered by inflammation, that's going to feel painful. One theory that describes chronic pain conditions arising in a patient is the idea of central sensitization. In this case, central referring to your central nervous system, which is your brain and your spine, and sensitization meaning hyperreactivity or hyperexcitability. Essentially, our brain and spinal cord and the nociceptive neurons, or the pain neurons in them, are hyperexcitable or very easily triggered. So what then causes central sensitization? Great question. The answer is long-standing low levels of systemic or peripheral inflammation. Try to keep up with me on this one. I will do a graphic of a circle to try to make this easier to understand. Chronic peripheral inflammation leads to chronic and sustained activation of our nociceptive or our pain neurons. This makes a lot of sense because if we have inflammation acting on our pain neurons, they're going to keep firing so long as that inflammation is present. When those nociceptive neurons fire, they cause release of something referred to as neurotransmitters. Neurotransmitters are the molecules that enable our nervous system to function. They are the things that are released between neurons to let them fire in synchronicity. That consistent release of neurotransmitters leads to hyperexcitability of our entire nervous system, including the central. That hyperexcitability of the central nervous system leads to increased pain perception to non-painful stimuli. And so long as we keep getting non-painful input or painful input, which we will because we live our lives, chronic peripheral inflammation will persist, which perpetuates the entire cycle. Whew, that's a lot. Now, this is considered a positive feedback loop because it does feed into each other. However, that in no way makes it a positive thing. So if the whole cycle begins with persistent levels of peripheral inflammation, what are the factors that contribute to developing that persistent level of peripheral inflammation? With this in mind, that is the weak point of this cycle and where our focuses should be as healthcare practitioners in treating the chronic pain patient. Immediate intervention against inflammation can be taken through corticosteroid injection or NSAID use, or non-steroidal anti-inflammatory drugs. However, these methods are just band-aid solutions. Why is the inflammation there in the first place if the person is absent any serious pathology, such as PMR or polymyalgia rheumatica? There are 3 factors that could contribute to sustained inflammation within the body. They are stress, diet, and physical activity levels. Cortisol is the body's natural stress hormone. It is secreted by our adrenal glands, which are located on top of our kidneys. It's important that we have cortisol because it is both a powerful anti-inflammatory hormone as well as the thing that gets us through the fight or flight response when our sympathetic nervous system fires on. Chronically sustained stress levels will lead to chronically secreted cortisol. Chronically secreted cortisol will lead to a very high concentration of it within our body. The body's natural response when a hormone is too plentiful within it is to decrease our sensitivity to that hormone. This is the case with type 2 diabetics who develop a desensitization towards insulin. The same thing can happen when we have too much cortisol in our system. Our body develops a desensitization to it. Once again, cortisol is our body's most powerful natural anti-inflammatory. If we develop a desensitization to our body's method of dealing with inflammation, we're going to have some sustained inflammation problems. Looking at the diet element, added sugars, processed foods, and saturated and trans fats are all considered inflammatory compounds. And funnily enough, added sugars and unhealthy fats are staple diets in the North American diet, especially the United States. Our bodies are these super complex homeostatic organisms where everything is consistently held in a healthy balance. Too much of a swing one way isn't healthy, too much of a swing in the other direction isn't healthy. They are prepared to deal with things that we naturally evolved alongside with, such as naturally occurring sugars and unsaturated fats. Our bodies do not always know what to do with modified foods. And when something is in our body and our body does not know what to do with it, it triggers an inflammatory response, such as the body's natural immune response to unknown things. Add to this the gross weight gain that can come with a hypercaloric diet, and we see decreased levels in our last factor, physical activity. Having some level of moderate physical activity included in your life is very important to make sure that the everyday physical tasks of living do not become too physically stressful. Avoidance of moderate physical activity leads to progressive deconditioning. The progressive deconditioning leads to increased pain perception on tasks that previously you were conditioned to do. Now that climbing the stairs per se is painful, you will try to avoid that whenever you can. And because you're avoiding that physical activity, it leads to more progressive deconditioning. And more progressive deconditioning leads to other tasks that eventually cause pain, and you avoid them. It's another positive feedback loop. It's no secret that the North American population is stressed out, doesn't eat particularly well, and is also not very active. Because of this, is it any surprise that 20% of the population is expected to be dealing with chronic pain conditions? I don't think it's a surprise. Not at all. In summary, one theory of how chronic pain conditions arise is through the phenomenon of central sensitization. Central sensitization is propelled by chronically sustained low levels of systemic or peripheral inflammation. Without intervention against this chronically sustained peripheral inflammation, the central sensitization and the chronic pain will very likely persist. And three of the most common sources of sustained inflammation outside of pathology include stress, diet, and physical activity levels. So then, how do we address those factors? Well, as seems to be a presiding theme with this whole channel, simple question, complex answer. Sit tight, I will be explaining that in the next video, which will be coming out, well, next. Thank you so much for watching, guys. Please subscribe down below, it helps me out a lot. You can click here for the previous video, and you can click up here for the most recent one. Have yourselves great days.